you're all refreshed? You're all comfortable? You are? Good. So our next speaker is a uro-oncologist who also has a PhD in kidney cancer, is internationally trained in Vancouver, is amazing, and also, and the only reason why we get someone so amazing is because he's also my husband. So Joseph's going to talk about what prostate cancer has learnt from breast cancer research. So thank you, Joseph.
It's a pleasure. It's wonderful to see so many people here. Thank you, Dale. So in that, Dale has had to live through me completing a PhD. I've dragged her to Vancouver with 3 young kids and she survived that. So she's done extraordinarily well. So as Dale mentioned, I'm a urologist, so I treat diseases of the kidneys, bladders and prostate, and penises and testicles, if you're so inclined. And one of the things that Dale wanted me to talk about was the 2 main cancers affecting men and women are breast in women and prostate in men. And there's lots of things that make them similar, and there's some things that make them very different. So I thought I'd just give you a quick summary of the sort of things we think about. I do a podcast as well, like every man and his dog. And one of the things that we covered doing this podcast with a medical oncologist who lives in Perth was what prostate cancer has learned from breast cancer. So there's a few things that, obviously, they are one of the most common cancers in their respective sexes. So 1 in 8 women will have breast cancer, 1 in 5 men will be diagnosed with prostate cancer. They're extraordinarily common. They're both sex hormone driven cancers. So it's estrogen in breast cancer, it's testosterone in prostate cancer. And one of the other aspects about them is they're both driven by very similar genes. They're both BRCA. You've heard of BRCA mutations, both extremely important in both cancers. And one thing that really sets them apart from a lot of other cancers, it was interesting listening to Nicole's story, and she may well have been through it, is everybody's really interested in these new wonder drugs, these immunotherapy, immuno-oncology agents, which work really well in some cancers. Like melanoma, 15 years ago, was a death sentence, metastatic melanoma. And now we've got these 30% of people that will respond to it for a very long time. Like, they just really have probably been one of the biggest changes in cancer today. Those drugs are completely ineffective in breast and prostate cancer. So it's one of those things that makes them very similar. Now, when we look at breast cancer, what is breast cancer doing better than prostate cancer? Now, I am not a breast cancer doctor expert, but I can tell you some of the things they do. One of them is breast cancer is miles ahead of prostate cancer when it comes to biomarkers. So I remember when I dragged Dale to Adelaide in 2004, I was doing the breast surgery job there as part of my training to get onto urology. And we would sit down and we would talk about their biomarkers, and then that would decide what treatment we do. So whether it's, are you HER2 positive, estrogen receptor positive, these sorts of things. That's a long time ago. In prostate cancer, we still sit down, we look at the low power microscopic appearance of the cancer. So we cut it up, they look at it, it's not even on high power, you're not even looking really closely. We're just looking at the overall structure of what it looks like, and that's what we do to decide how bad this cancer is and what the best treatments are. It's almost prehistoric. This system was devised in 1969 and we have not done anything better in the meantime. Breast cancer is miles ahead of us in this regard. The trials that have been done in adjuvant treatment, so you don't just have surgery now, you have radiation and you might get some extra treatment. Breast cancer is a long way ahead of prostate cancer in this regard. They've got much better data around what should you be doing as well. Prostate cancer, we're still sort of making it up. We probably didn't do the right trials early on because we were too busy arguing about whether the prostate should be taken out robotically or not. We got a little bit sidetracked for a few years there. Breast cancer's done an excellent job in that regard. Breast cancer is much better with their genetic counselling. So BRCA, for example, is only really something we've started discussing in the last sort of 2 years in prostate cancer. Obviously, if you had a BRCA mutation, that really changed how your breast cancer was managed. So to give an example, so in prostate cancer, there's lots of men that have prostate cancer. They get told, this is a cancer we can keep an eye on and you don't need treatment because it's probably not going to affect you in your lifetime. Now, and that used to be very true. And I'll give you an example. I've got a patient who he's had 5 sisters and 1 brother had all been diagnosed with cancer. So 5 sisters with breast cancer, brother with prostate cancer, and he's the 7th kid, and he was BRCA positive. We did a biopsy on his prostate for just a blip in his PSA, and it came back with this extremely small amount of the very low risk prostate cancer. Now, 2 years ago, I would have said, you know what, don't worry about it, we'll just sit tight, you've got nothing to worry about, we'll keep an eye on it. And we thought, no, now that we know that you're BRCA positive, let's go take your prostate out. So we took his prostate out, and in fact, he had a very aggressive cancer that just wasn't picked up in the biopsy that we did, because we know that's how these sorts of cancers behave. So breast cancer has been very good at getting those biomarkers sorted out nice and early. Things that prostate cancer actually do better. So this is some things that, so that's where breast cancer's ahead, and I can even give you some reasons to why that might be the case. But prostate cancer has much better data around the metastatic disease space. So if you're looking at how effective is chemotherapy, how effective are the newer agents, you know, we've got these new sort of super androgen receptor drugs that can really target the cancer and stop it from growing. We've even got immunotherapy in the form of we take out people's blood, supercharge their immune cells and put it back in. We've got really good overall survival data for that, whereas the breast cancer hasn't got quite as good as effective information in that sort of space. So prostate cancer is doing some things very well. There's two other things that prostate cancer does well. One of them is this concept of active surveillance that I touched on before. So these cancers that we can, well, you've got cancer, but don't worry about it, it's just something we need to watch. There's no real concept of that in breast cancer. Everyone has gone, oh, you've got a lump in your breast, it gets taken out. You know, we never just sit and watch and say, oh, it's slow growing. So I think prostate cancer is doing a good job. And, you know, there's probably a lot in the news recently about, are we over-treating cancers? And that's certainly a real issue and something that we continue to struggle with. And one of the reasons that we know that active surveillance for these low-risk cancers is common is because these are things that I say to my patients every day when I see them, is you go, well, you've got a bit of this low-risk prostate cancer, and say the guy's 65 or 70. And I say, if you and 9 of your friends drove off a cliff in a bus, unfortunately, and we got your prostates and we cut them up really finely, 6 or 7 of your friends would have this type of cancer. Clearly, all your mates are not about to die of prostate cancer. This is something we can watch. We know from autopsy studies that it's safe. So active surveillance is something you will see more of. These are cancers that we're detecting really early with screening programs and better education, but they don't need treatment because lots of people, unfortunately, if you don't exercise, you're more likely to die of a heart attack. And then the final thing is, and this is where prostate cancer's really got breast cancer beaten, and that is in the PSA test. So this is a blood test that is very good at detecting prostate cancer. So it gets a bit of a bad rap because unfortunately, and I'll sort of tell you things I tell my patients, is there's 3 things that can put your PSA up. You know, all men are worried about their PSA. So I say there's prostate cancer, that's what we're worried about. There's big prostates, and there's prostates that are causing you a bit of bother, whether that's infection, irritation because they're having difficulty peeing. You know, you've got your husbands or you blokes who know you're starting to get up at night, the stream's not what it was when you were 21. That can put your PSA up. And I say, those last 2 just don't matter. I've got no way of telling them apart. And that's why it gets a bad rap because, you know, urologists, the prostate snatchers, we're taking at everyone's prostates, or we're over biopsying men. Once you start putting it into context, you actually then can start saying, look, this is really the bloke that I need to worry about. And we've got MRI tests and all these new ways of really determining who's the best person to go and investigate further. But where PSA really comes into its own is after you've had treatment for prostate cancer. Then it is extraordinary. There is no better biomarker in medicine for following the progression of a disease than PSA. So that's one thing that it does very well in prostate cancer, where it's probably ahead. And just to finish, I'll just sort of say, why did breast cancer get a 15-year jump on prostate cancer? And it probably comes down to a very interesting thing that happened back in the 70s and 80s. Actually, it was the 1980s. So does anyone remember Ronald Reagan and his Star Wars? Remember how he wanted to get up and put satellites up there? And most of the other politicians thought that was a pretty silly idea. But Ronald Reagan wanted his Star Wars satellites. And so this is just the craziness of research. So they said, look, all right, Ronald, we'll give you your money for Star Wars, but you've got to fund research in breast cancer. That was literally how it got through. So back in the 80s, and this was the reason, because a lot of the senators at the time, they were say they're in their late 50s or 60s, their 50-year-old wives were getting diagnosed with breast cancer. They did not have prostate cancer yet. It was one of the big differences, is prostate cancer affects men about 10 years later. So what they did was they attached this funding bill to the Star Wars program, and all of a sudden there's this explosion of amazing and excellent research for like hundreds of millions of dollars, which is sort of out of the world, out of this world from what we think now. And so they got this jump on us, and that's why you'll see, and you've got to be looking at the research papers pretty closely, but it'll often say funded by the Department of Defence. You think, why is the Department of Defence funding breast cancer research from the 80s and 90s? And so now what happened is, anyway, all these senators ended up developing prostate cancer. So in fact, in the 90s, a lot of Department of Defence funding went into prostate cancer, and that's why we're catching up. So I hope that was a little overview of how prostate and breast cancer are a little different, and I hope you enjoy your evening, and congratulations to Dale on putting together such an amazing event.